Good afternoon to you all. It is a pleasure to me being able to talk with you today about T3 as a predictor of mortality in any cause of in any disease in non-critically ill patients. First thing, let's remember about the non-thyroid illness syndrome or low T3 syndrome that is characterized by changes in serum thyroid hormone levels, as we can see here in this chart, with high levels of RT3 and low levels of T3 from the beginning of the disease. And this is this occurs without any hypothalamic, pituitary, or thyroid dysfunction. This is about alterations that are proper from the disease, the patient disease. There are several small studies from patients with sepsis, from patients with heart diseases or stroke, that have been suggested that whether T3 is an independent predictor of short or long-term survival. From this idea, we developed this work, which the primary goal was to determine the correlation between low levels of plasma T3 hormone at the hospital admission and the T3 mortality. The second outcomes of this work included the 6-month overall mortality, as well as hospital length of stay and hospital readmission. This work was a prospective cohort study from consecutive patients that were admitted to the internal medicine ward of a tertiary hospital in southern Brazil. There was a total of almost 700 patients that were evaluated, and 345 patients were included in this work. These patients were followed for 6 months to evaluate the health status and also the hospital readmissions in this period. Patients were divided into groups. The low T3 group with patients with less than 75 nanograms per deciliter of T3, and the normal T3 group with more than 75 deciliters. This was independent of the cause of admission. Here we have the first table when we can see the characteristics, the main cause of admission at the hospital, and we can see that this is basically the same from the low T3 group and the normal group. And here from the demographic data, we can see we have a little bit more older patients in the low T3 group, as well as a little bit more patients with type 2 diabetes in the low T3. Overall, the two groups were very similar. This is this is a very, very interesting figure, because here from the beginning we can see that those patients that are survivors from 30 days or even after 6 months, they have very high levels of T3 from the admission and until discharge or until 6 months. And also those that are non-survival, they had the lowest levels of T3 from the beginning of the admission. And here we have the hazard ratio of 7.3 for 30 days mortality in those patients with low T3 syndrome, as we can see here, and as well as after 6 months of the disease we also have a hazard ratio of 2.9, and we can see clearly that the curve points for augmented mortality in this group. When we developed the univariate hazard ratio for predicting the 30-day mortality, we can see that age, T3 at admission, neoplasia, and also the standard scores, the standard clinical scores were significant as predictors of mortality. In the logistical regression of these variables, we can see that still T3 at T3 levels at admission, as well as age and chronic liver disease and also neoplasia were still independent prognostic factors. And here, these rock curves show us that, yes, T3 not only at admission, but also during the hospital stay of the patient are as sensitive and as specific as the standard Apache chart or Charlson charts that we have for specifying mortality from the patients, and as well as at 6 months mortality, we also have T3 at admission or at any point of during admission of the patient. We can see that T3 levels are really sensitive and specific in predicting death after a hospital stay. So from these curves, we can see that T3 can predict prognosis at any moment of the hospital stay, even with no previous T3 measurements. So the conclusion of this work is that this study demonstrates that yes, low T3 is prevalent even in a heterogeneous cohort of general ward patients, and very importantly, it acts as a reliable indicator of poor prognosis and mortality. Low levels of T3 on admission are associated with higher scores of severity and shorter readmission-free periods, regardless the disease of or previous T3 levels. For your attention, thank you very much.